This is Dr. Do again. This video is alphabetic list problem, still on a letter H. Today I'm going to talk about a condition called hypoxemia and also associated with hypoxia. First of all, are there any emergency situation associated with hypoxia or hypoxemia? Yes, hypoxia, which means the tissue is lack of enough oxygen to perfuse, to provide the fundamental need for metabolism from the cells. So that hypoxia could be very serious, either from the heart causes, from the heart cannot provide enough blood, or the red blood cells cannot carry enough oxygen, or the exchanging process cannot carry on in the peripheral tissue. So these are all the possibility to cause the hypoxia. It is dangerous. So if it's usually this hypoxia associated with hypoxemia, which refers to the blood, in the blood lack of oxygen level. So regardless, this is a kind of detailed differentiation. Regardless either hypoxia or hypoxemia, if associated with the symptoms of gasping for air, change the color of cyanosis, particularly if it's acute situation or with past medical history, either COPD or asthma or heart disease or hypertension, develop this shortness of breath and gasping for air, and change the color of the skin from flash like the red, pink into cyanosis, which means blue. And these are all the signs of emergency situation. You need to go to the emergency room as soon as possible or call your physician to discuss. And is there any situation associated with this hypoxemia you manage at home? Probably not, because if the either hypoxia or hypoxemia, which means the body function from the airway to the blood cells that carry oxygen, or to the peripheral tissue that metabolize used oxygen. So any of these three important steps in this pathway had the problem, will lead in the hypoxia or hypoxemia at the early stage. So this is regardless of the causes, probably cannot be managed at home, has to be managed by the medical professionals, and have to see a physician to diagnose and to find the cause of this hypoxia or hypoxemia and then treat it. So having said about that, I already talked about the oxygen, how it's at the molecular level, oxygen is required. It's so important because it is serving the major oxidant to generate energy. You probably already know it. And I also talk about the oxygen through the respiratory system, carried by the mechanism of the exchanging in the alveoli around the lung, and then release the carbon dioxide and carry the oxygen in the red blood cells circulating to the peripheral tissue to provide. And then at the peripheral tissue also undergoing exchange, load the carbon dioxide, unload the oxygen, just opposite from what's happening in the lung. So this is the fundamental mechanism. What are the causes for the hypoxemia? Hypoxemia referring to the blood oxygen level is low, mainly by the respiratory system, because the lung, if cannot carry on the fully function, the oxygen cannot be loaded to the red blood cells, or the red blood cells itself is not enough, cannot carry, like anemia, cannot carry enough oxygen. So this will cause the hypoxemia, which means the oxygen in the blood circulating system is lower than supposed to be. And this hypoxemia eventually will lead to the hypoxia, because the not loaded enough oxygen and reaching the peripheral tissue, of course, cannot provide oxygen for the tissue to metabolize and then generate the hypoxia from the tissue, which is defined as hypoxia. Basically, it's kind of subtle difference, one leading to another. And what kind of symptoms or signs associated with this hypoxia or hypoxemia? Some of them could be very obvious, like gasping for air, shortness of breath, or some of them might be subtle, like anemia. You just feel tired, lack of energy. I already talked about that. And some of them probably in the middle, like the history of asthma, intermittently sometimes with this spare up of the asthma or the COPD in the phase of flaring up. These are all the causes. Or the heart, either the arrhythmia or chronic cardiac disease from the cardiac muscle, the valve, and also the blood vessel. So any of these organs or tissues cannot function well will cause the hypoxemia and eventually leading to the hypoxia. So basically, and what are the signs, like I said, and in terms of diagnosis, it's really straightforward. If you have those kind of symptoms or signs, looking pale, feel tired, or shortness of breath, chest pain, or feel gasping for air, etc. If these kind of symptoms occurred to you, once in a while, with obvious, if you have been healthy, once in a while you feel tired and from the causes either stress or did not sleep well, and it resolved by itself after good night's sleep or after replenish. So that is okay. But if it's persistent, even though the symptoms might be subtle, like feel fatigue all the time, you need to call to see your physician to get it checked. As in terms of diagnosis, quite straightforward, either by the oxygen saturating the blood, which is, you already know it, test something, put on your fingertip, can tell how much oxygen in the blood by how many red blood cells are saturated. 90, above 95, usually 95, about average about 95. So if lower than 90, that's probably a sign, or even sometimes it's even lower. That's really kind of dangerous. And quite straightforward. Or the draw blood to test the gas level, either carbon dioxide or the oxygen level in the blood. Get a detailed analysis of the oxygen status or situation in the blood. Or some other affiliated, like EKG or X-ray, they all can help to diagnose. It's quite straightforward, unless there's some other comorbidities, like the coagulation problem, cause the PE, that's probably require complicated diagnosis. But in general, if you do not have serious problem, then this kind of diagnosis is quite straightforward. And in terms of treatment, oxygen of course, and also treating the causative cooperative diseases, like if you have asthma, of course give you a dilator. If you have PE, then treat it with the heparin or associated anticoagulation medication. If you have heart disease, treat accordingly. So basically the taking home message is, if you do not know you have diseases, if ongoing shortness of breath, tired, fatigue, and or you look pale, so if these are the signs, and unusual pale, and some of the so if these are the signs, then you can really call your physician to get it checked and then to treat it at early stage. So this is about the video today, hypoxia and hypoxemia. Thank you for watching. I will see you next time.